What is amniocentesis for sickle cell diagnosis? Imagine learning early if your unborn baby might have sickle cell disease. That's where amniocentesis plays a key role. It's a medical test done during pregnancy to find out if the baby has certain genetic conditions, including sickle cell disease. This disease is caused by a change in the gene that affects hemoglobin, the protein in red blood cells that carries oxygen. When someone has sickle cell disease, their red blood cells become shaped like crescents or sickles, which can block blood flow and cause pain, anemia, and other health problems. Amniocentesis is usually performed between the 15th and 20th weeks of pregnancy. During the procedure, a healthcare provider uses ultrasound to see inside the mother's abdomen. They then insert a very thin needle through the skin and into the amniotic sac, which is the fluid-filled space around the baby. The needle is guided carefully to avoid harming the baby. A small amount of amniotic fluid is withdrawn, typically about 20 milliliters, or roughly a tablespoon. This fluid contains fetal cells that have shed from the baby's skin, lungs, or urinary tract. Once collected, the fetal cells are sent to a laboratory. Scientists analyze the genetic material in these cells to look for the sickle cell gene mutation. If the mutation is present, it indicates that the fetus has sickle cell disease or is a carrier of the gene. This information helps parents and doctors make informed decisions about the pregnancy. It's important to remember that amniocentesis is an invasive procedure, meaning it involves inserting a needle into the body. Because of this, there is a small risk of complications, including miscarriage, which is estimated to be less than 1%. Because of these risks, doctors usually recommend amniocentesis when there is a known risk, such as if both parents are carriers of the sickle cell gene or if there is a family history of the disease. In summary, amniocentesis for sickle cell diagnosis is a safe and effective way to detect the disease early in pregnancy. It involves sampling amniotic fluid to analyze fetal cells for the sickle cell gene mutation. This test provides valuable information to help parents prepare and make choices about their pregnancy. If you are considering this test, it's best to discuss it with a healthcare professional who can provide guidance based on your personal health history and risk factors.